not vocal fatigue, but I mean being tired. And she goes all the way around to the major horns, and then down the posterior border. Anything sore today?
A little tight.
Okay, so now what we're going to do, and she's going to use her incredibly good posture and alignment. Thank you. She's going to work her larynx position down a little bit, kind of grabbing over here as a nice big space over here. And sometimes I have the patient do a little yawn, kind of fit their fingers in here, and then pull it down with a little bit of a wiggle. Do you feel it moving?
Mm-hmm.
Good.
It's so much looser than it was before when I first started.
And let's work under the tongue a little bit. Just take the thumbs. We want the tongue to feel like, people refer to it as a piece of steak. I've decided it's a piece of lox hanging off the bagel. Okay. Because singers can have a lot of tongue tension, being that it is attached to the hyoid. It kind of causes some issues. And finally, just in case we have some clenchers or grinders, we're going to do a little bit of jaw work. So let's find the masseters by biting down. Find those little bulges, and then let's give them a massage. Any tenderness in there today?
A little tender.
Okay, so we'll work that a little bit. And then, of course, we'd be doing a lot of things a lot longer than what you might see here. We also do a fair amount of counseling because there is high stress in many of your professional voice users' professions. And let's get in there with our, if you want to work the TMJ too, of course. But let's get into the masseter. Press in with your hands and pull down and stretch. Certainly a nice thing to do before singing, to have these muscles warmed up so that when she goes to hit the big high note, she doesn't feel any tension in her jaw. Okay. Melissa's very, very good with midsection breath support, but we're going to demonstrate it anyway just so you can see how it's done. We're going to use a biofeedback device today. We're going to use a belt. Like we tell patients, it's very socially acceptable. You can use it all the time. But in this case, we're going to make the belt a notch tighter than we normally would. We have to be careful because last night I had a patient go like this and the whole belt burst apart. That was the first in all these years of practice.
I never wear this belt. I just went to.
Yeah, it's skinny.
I bought it for like 80s night or something.
Yes. We probably use one that's a little wider. We want it to be annoying. So no stretch belts, no sweatpants. We really want it to be annoying. So I want you to inhale and imagine that you are the Incredible Hulk and you are going to bust out of that belt with your abdominals. Good. And when she exhales, she compresses the abdominals. That's when she's going to be manufacturing the tone. All right, inhale, stretch, and good. Now, if you'll notice, where the belt is that's built into her skirt, that's actually where she's breathing. I kind of like you're using the lower abdominal muscles, but that's okay. Can't get that skinny little thing over there, but that's perfect. Okay, you can take the belt off if you like.